I'm Dr. Azhar Alam, consultant gastrointestinal, advanced laparoscopic and laser surgeon. And today I'm going to discuss about something known as colorectal cancer or colon cancer. So cancer, in a word, it is something which scares and terrifies everyone. But what we have to understand is this cancer is something like any other disease which today has a very good management provided we know how to deal with it properly. So to begin with, what are the causes or the risk factors for colon cancer? So the risk factors of colon cancer are number one, family history. So if there has been an instance of someone having colon cancer in your family, then there is a strong chance for others also to develop this problem. Colon cancer normally affects people of the higher age group, that is older people. Then there are lifestyle factors like people who consume alcohol and who smoke. They are at a higher risk for developing colon cancer. Diet plays a very important role. So if you have a diet which is rich in animal protein, fats, then and low in fiber, so that has a higher risk of colon cancer. And also there are certain conditions like polyps, inflammatory bowel diseases, genetic conditions. All of these predispose to colon cancer. So what are the symptoms of colon cancer? The symptoms of colon cancer are actually quite variable. So it's important for people to be very careful. Bleeding in your stools. Bleeding in your stool is one of the symptoms of colon cancer, but that does not mean every time there is blood in your stool, you are at risk of colon cancer. There can be a change in the bowel habit. So a person who normally had a very healthy bowel habit, suddenly he sees that the bowel habit has changed. Say he started developing frequently constipation or frequently diarrhea. That could be an indication that something is not right. Then there could be a feeling of incomplete emptying of bowels. So you go to the washroom, you feel that you've passed stools, but still there is something which is remaining and you are not totally satisfied with the passage of the stools. So that could be a risk factor for colon cancer. Then abdominal pain. At times it presents with abdominal pain. Then people who feel a lot of weakness, early fatigue, that could be a sign of colon cancer. Any anemia, you've gone for a routine screening test, hematological test, and you see your hemoglobin is low, but there is no sign of blood loss. So anemia which is unexplained, that could be a symptom of colon cancer. And a very important symptom is unexplained weight loss. That is, you slowly realize you're losing weight, but you're not doing anything for the weight loss. And how do you understand that you've lost weight? You see your clothes are getting loose. That is an indication that you've suffered from unintended or unexplained weight loss. So how do you diagnose colon cancer? So for example, if someone has an episode of bleeding while passing stools, that does not mean he has cancer. But at the same time, if someone has the history of passing of stools and he's sure that he does not have colon cancer, that is also wrong. What you need to do is you have to visit a specialist. The specialist will first examine you and he'll prescribe you certain tests. Mostly a colonoscopy is good enough to primarily diagnose the cancer. So what you do in a colonoscopy is you pass a tube with a camera inside the colon. It takes a full image of the entire colon, and if there is any suspicious mass, it will also take a biopsy which can later confirm the cancer. For spread of cancer, if a person has colon cancer, the next step is to evaluate whether the cancer has spread or it has remained confined in its original space. So to investigate whether the cancer has spread or not, you need further tests like a CT scan, ultrasound, chest x-rays, etc. So basically, clinical examination, colonoscopy and imaging tests. These form the basic fundamentals for diagnosis of colon cancer. So we've understood how to diagnose colon cancer. Now the next step is what to do about colon cancer. How will it be managed? So there are three modalities with which we treat colon cancer. One is surgery, the second is chemotherapy, and the third is radiotherapy. What we have to understand is surgery forms the mainstay of treatment. That is, the main treatment in the management of colon cancer, which can be operated, is surgery. chemotherapy and radiotherapy are supportive methods. So after surgery or before surgery, you may need a supportive chemotherapy or radiotherapy based on the staging of your disease. But primarily, surgery is the main treatment for colon cancer. Now, a lot of people ask and want to know what the prognosis is or what the overall survival rate is. So for early cancer, in which it remains confined to the colon, for early stages, we have 5-year survival rates of more than 90 to 92%. For colon cancer, which has local spread, that is, it involves the surrounding nearby lymph nodes, the survival rates is around 74 to 75%. And for advanced metastatic colon cancer, in which it has already spread to a number of organs, we have a 5-year survival rate of around 15%. However, that said, colon cancer is a very treatable disease if it is diagnosed early, if it is managed properly, and if you do the right things in how to treat it instead of just being scared about it. Thank you.